Welcome everyone to our webinar today. I'm Lynn Kintz. I'm the Executive Director of the Hemophilia Council of California, and we want to welcome you and thank you for joining us today.
You can learn more about Let's Talk at letstalkmh.com. We'll have information including when there are upcoming screenings to attend at letstalkmh.com. And there'll be links there as well to, amongst other resources, Mental Health Matters Too. So speaking of Mental Health Matters Too, Debbie, and again, feel free to put any questions down or comments in the chat at any time. But Debbie, we know that there's a couple of questions you tend to get most often. So I want to give you a chance to kind of speak to those right away. When people come up to you and they want to know, I'm not maybe feeling great. I'm not feeling 100 right now, but I hear people mentioning anxiety. I hear people mentioning depression. I hear people mentioning trauma and therapy, but I don't know, am I just in a funk? Do I just need to eat a little better and then I'll be fine? Or is this something I need to go see a doctor for? Do I need medication? How do you help people who are at that stage of the journey, just trying to figure out, is there something I need to do? Is there something wrong?
Yeah, what I like to do is what I hope a lot of people are doing. I think we're getting better at it. We're looking at mental illness just like we look at hemophilia, our von Willebrands. I mean, you know your body, you know your mind, and you know when something's not right. And if you want to figure out if you're having a mental health condition, you do just what you did with our bleeding disorders. You go and figure out what are the signs and symptoms. And yeah, it can be more difficult with mental health because it changes, it's subjective, and all of those other variables. But if you look at three ways, Patrick, it's how are you behaving, how are you feeling, and how are you thinking? And look at that in the sense of, does it match the criteria for depression, anxiety? But the telltale sign is really having to do with impact, is how I'm thinking, feeling, behaving, getting in the way of my best life, getting in the way of me even being in my life. So it's really impact, it's signs and symptoms, and it's education, just like we did when my little guy had his first joint bleed. That was a symptom. I had to figure out what it was, how to deal with it.
Like you said, and you didn't then treat your little guy, who shares a birthday with me, by the way. That's
big
not really
time. It's coming
else,
up.
but it's coming up soon. Yeah, so I'm excited. Jorgito and I have that in common, as we do hemophilia A. But you also did not treat him for a bleeding disorder because there's no medication to treat a bleeding disorder. There's no management plan for a bleeding disorder. We only have those things for hemophilia A, hemophilia B, factor V deficiency, von Willebrand disease. And the same is true here in mental health, isn't it? That we can't just treat mental health. We need to know what, you've used the term a couple times now, the signs and the symptoms, so we can start to actually figure out what's going on and then connect that individual to an appropriate resource. So to flip the script just a little bit, Debbie, what happens when you're on the other side? What happens when you see a loved one or a close friend or someone in your immediate life who you're wondering, are they struggling beyond just a funk? Is there something here that should I be doing something? I certainly don't want to not do something and then find out that this person was really, really suffering or, forbid, just takes their life. What do you encourage people who are in that position, but maybe a little bit frozen by what am I supposed to do? I'm not a licensed counselor. What am I supposed to do, Debbie?
It's amazing. It depends upon your role too, because family members to family members, that's a real difficult conversation sometimes because it can come with a lot of baggage. Like if I can prove that my husband's having problems with depression, I don't have to look at my own stuff. But really, it's the human connection. Just like we have when we're together at these conferences, when we were able to be at the conferences. It's a human connection of, I'm seeing this in you. I'm wondering if you're feeling this way. This COVID thing is really getting to me. I'm feeling anxious. I can't sleep anymore. Taking it from that perspective, that this is a common, mental health conditions are common. And if you're human, like I am, it's very likely you're struggling with this too. In other words, I'm trying to say you approach it from not you have this and I don't. It's I love you, I'm observing this. I'm wondering if you're having some trouble. I know there's resources out there. Let's see what we can come up with together, but in a real non-judgmental, less reactive way.
Yeah. And I'm hearing too the holding space, the allowing for that person's experience to be there. Maybe if I do relate to some piece of it, I like what you just made the point. It's not that, oh, you've got a thing and I don't. It's really, it's a spectrum. All of us at some point feel anxious or feel depressive because of a life event. It's when those things become disordered that there's something more to look at. But it's not as though these are unrelatable feelings and unrelatable thoughts. And I think that's something that's so important for people to hear. Even something like suicidality that's so unspoken, to know that it's actually very common that people have thoughts of that. The difference is when those thoughts become a plan, and then then some alarm bells need to start going off.
And I think that's the beauty of your film too. That's what you started out with, is suicidality. And then later we see Chris talking about it in his whole journey of being in that dark space and now being in a more functional place and now a helping agent. Hey guys, I went through this. It's okay to talk about it. So sorry I interrupted you, but that's so cool about your film.
No, I appreciate that. I think that's a great point. I think Chris's story is, I mean, his story was the first one when we were doing the casting process, Debbie, as you might remember, when he shared it. And I've known Chris for 20 some odd years, 25 years. I had no idea about this though, but he had said, I've been processing this experience that I went through, and I was just floored by his story. So it's very grateful that he shared. I want to call out a question here from Grace Hernandez. Hi, Grace. There's much talk about alternative medicine for pain management to assist medications or replace the need for them. Is this the trends, something that mental health treatment is moving towards instead of just medication? What have you picked up, Debbie, about alternative approaches to pain management?
Yeah, and first I need to say the caveat that I'm not a medical professional. I'm a licensed professional counselor. But this gives me a chance to speak to the fact that mindfulness-based stress reduction and therefore chronic pain perception reduction, that all originated from a gentleman who studied those people who are in chronic pain. He noticed that there were common thought patterns associated with pain, like black and white, catastrophizing, or what have you. And it's through his work that we now do know that meditation is can be very, very effective means of affecting pain. Because we also know that the more depressed someone is, the more likely they're able to, the more likely they are to perceive their pain as intense and unmanageable. So I can speak to mindfulness.
Would you, I think meditation is something that can be intimidating. If you've never done it, or even if you have, I know at times if it feels far away and someone brings up like, have you tried meditating? If I'm feeling stressed, I'm like, no, I know. But would you mind just maybe either reminding us or teaching us anew, what exactly is meditation?
Yeah, meditation, it's what it is basically being intentional about being in the present moment and focusing on what you can control at that moment, which is your breathing. And actually utilizing your breathing rate to slow down different parts of your body that are in the fight-flight response. So basically what you're doing is staying in the present moment, which you are fine, and being intentional about your focus. And just by relaxing the entire body system, you can reduce the perception of pain. That's in a nutshell.
That was really good. And I found, speaking from personal experience, that it also helps me, in a way, detach, which feels like a funny word to use in describing meditation, but it helps me kind of slow down and almost see myself and the world from like a bit of a removed perspective. Like my ego and all the energy is kind of calm, and I can just note the thoughts that are going. I don't have to react to all of them. I don't have to do anything. I'm actually only here in this meditative moment to just note what's happening, but to not necessarily do anything about it. And there's no other time in my life where that's true. If I'm not consciously meditating, there's not another moment in my life where I feel as though I can just allow thoughts and allow feelings and just move. I'm going somewhere. I've got to do something. I have to apply it to something. I've got to put it away and move on. But it's such a breath of fresh air in a way to be able to just let those things, even for 2 minutes. Sometimes I set my timer on my phone. If I don't think I'm going to otherwise do it, I'll just be like, set a timer for 2 minutes, and I'll put my phone down. And I'll just start, so I don't even have a chance to second guess myself. And before I know it, the 2-minute bell rings.
That's what people are finding. But at the same time, I remember that gentleman at a conference that just said, oh my gosh, if somebody else tells me to meditate through my pain, I'm going to absolutely, I can't even repeat what that gentleman said. So not to say that's the do all, fix all.
Well, and that's such an important point. Pain and mental health both are very individual experiences, and a resource, a tool that works for one person may not necessarily work for someone else. I know we didn't get to it today, but Bobby Wiseman, who I imagine many, if not most here know, who's in the film, he mentions in the course of the film to talk to someone, and how, you know, his first therapist, it wasn't necessarily the right one. The second, the first friend you talk to might not be, but keep going until you find that right person. And I think that's really important advice. Another thing that, Debbie, in terms of resources or tools, if meditation is, we discussed that one, put it over here. Telehealth, that's something that has existed prior to COVID, but we've certainly been using it a heck of a lot more in 2020 than ever before. And I know you, as a clinician, as a therapist, have worked via telehealth this year. So what can you share with people, especially who have never gone to any kind of therapy? What can you share about telehealth, and maybe why that is like as good of a way to start as any?
No, I've had the advantage of being in person doing therapy, also receiving therapy in other circumstances, but doing in-person therapy and also online. And I can tell you, Patrick, that what I've experienced as an online therapist, if people are more relaxed in their home, because you have the same component. The most important part of a therapeutic relationship is that there's a sense of caring, that you're on my team, empathic, and that you understand my problems. All of that still transpires because of the method of being able to see someone and see the reaction and the back and forth. But people really have enjoyed how convenient it is, how it gets rid of all those obstacles of transportation and childcare. It's more affordable, and now the research is backing it up that it's not only just as effective as in person, but there's this added bonus of the bibliotherapy that can take place almost, we're exchanging books and worksheets almost instantaneous. And now therapists can be messaged 24/7 too. And
For better and for worse.
well, you set boundaries around it. Like,
course,
yes, you can go 24/7 and I'll be responding at 4 p.m. each day,
Right.
But that didn't exist before. People just have to hold an uncomfortable moment or questions.
That bibliography, I hadn't even thought about that. The ease and speed with which you can share a document, a resource, a link to something. It's because too often, when I'm in the room in therapy, this has happened plenty of times where something's come up and I'm like, okay, I'll remember that. No, 20 minutes later, after we've talked about a couple other traumatic moments of life, I don't remember what it was anymore. But if it's just there right away, and we're going to speak a bit more about resources specific to California. Lynn has compiled a strong list that we're going to close out with in just a few minutes. So we will come back to this piece on resources. Debbie, I wanted to ask you though, maybe as we start wrapping up this portion, about research and what we know, the data that tells us specific to our community. You know, you and I have talked about this a lot, and obviously the need within our community has been made clear by sessions like this coming forward because people are requesting them. So the need is quite clear. But what do we actually know about mental health challenges and blood disorders, if anything? What do we know?
It's amazing. I looked through that's what I started in 2018. I wanted to get the presentations together, the resources, and I thought, but what am I talking about? I need to know exactly the prevalence and type of conditions. And it was a very frustrating source from a layperson's point of view, meaning that I didn't have access to all these expensive journals. I want to start out by letting Lynn and everybody else know how people can gain access to these through PubMed or Wiley online, and I'll be glad to share that information. But really, what I found out is that we knew about different subsets. Those with inhibitors, those with HIV were more likely to develop conditions of, depression, anxiety. But boy, this researcher in Iowa this year put together a meta-analysis and a literature review of, thousands of records, including 28 studies that scanned 30 years. And what she came up with, and it was nice to actually see a number, but I need to be very careful with these numbers too. We know that 1 in 5 people in America in any given year experiencing their mental health condition, including anxiety, depression, bipolar, you name it. So now that's a lot. That's a lot. But this study came up with the idea that it might be more like 2 in 5 individuals in our community in any given year struggling with the gamut, including substance abuse and ADHD, which I thought was really interesting in children. I hadn't seen a study or analysis of that before.
And you
So,
know, as you said, it's important with number. It can sound small, okay, as opposed to 1 in 5, it's 2 in 5, but that's double. That's twice as common. That's not small. That's actually extremely significant, isn't it?
it is, and people really need to hear the words in a given year. People need to understand that that doesn't mean 40% of us are going to be depressed and anxious. And so we know there's different mild, moderates, there's different stages of life. But it's a great reference point because what I found out is that they were all of these different studies. They didn't have a common assessment tool to study what is depression. They all had these different tools that they were using. So I was glad to see this study come out.
Yeah, and we're appreciative of you doing all this work to be able to present it to all of us. So thank you for
Mm-hmm.
taking that on. There's
Absolutely.
one more remark in here that I'll read out before Lynn will, I think, kind of move us through those resources. How important do you feel it is for people with bleeding disorders to be connected with the bleeding disorders community for support, especially for mental health, stress, and pain associated with having or caring for someone with a bleeding disorder? Debbie, what's your take on that?
Yeah, that's an interesting question that came up now because that is where I started. The first study I saw about bleeding disorders and mental health conditions was out of the Arizona Treatment Center back in 2012. 33% of those gentlemen experienced symptoms that were congruent with depression, right?
Mm.
And they ask, what's the factors associated, what's the commonality with these gentlemen who are actively have a diagnosis of depression? And it was lack of social support. The other
Mm.
one had to do with lack of purpose, meaning they
Wow.
had unemployment. Lack of, that was one of the 2 highest indicators that someone could develop mental health problems.
Well,
And plus we know that by the research.
I mean, so that kind of speaks for itself that it's very important. And I'll just share anecdotally that there was a meeting a few years ago, a Blood Brotherhood meeting, where it's only adult men with hemophilia or
Mm-hmm.
bleeding disorder. I want to say there were upwards of maybe not 100 of us, but I'll say maybe between
Wow.
80 and 100. And it was either an hour and a half long meeting. The first topic that was brought up as soon as the meeting opened, right away, depression. We didn't talk about anything else. We spent the entire meeting on that. And that to me was literally one of the moments that I walked out of there being like, we gotta create what's become Let's Talk. Like we gotta
Mm-hmm.
push this conversation along. We gotta amplify this conversation because we don't see each other ever. We came into this room and we talked about this exclusively for an hour. 65-year-old guy, 22-year-old guy,
Mm-hmm.
everything in between. So all right, that's a lot. Debbie, thank you for being the fountain of knowledge on all this. And again, for being out in the front, doing the work, calling all these things together. Mental Health Matters 2 is Debbie's organization and website, which you can also find via letstalkmh.com. And with that, Debbie, thank you once again for joining me doing this.
Absolutely. Can't wait for the next time.
And Lynn, I will pass the metaphorical microphone back over to you.
Let me catch it. Thank you both so much. Way too short of a conversation, but we appreciate being able to have the conversation nevertheless. We want you to know that the Hemophilia Council is here as a resource for you. If you are trying to track down those services, we're not necessarily experts in mental health, but if you're trying to track down those services and you don't know where to start, feel free to contact us and we will try to get you in the right direction. We want you to be able to access those services if that's something that you feel like you need. And like I said, we understand that it can be difficult when you're in that spot of feeling anxious or depressed to get to those services. And so if you get overwhelmed looking at the resource sheet, feel free to call us and we'll help you kind of track down something that would be good for you. Thank you again for joining us and hanging in with us through this conversation. We hope that it was helpful to you. Patrick and Debbie, thank you so much for your work on this project. I think it has been so immensely valuable to the community and for taking the time to chat with all of us today. My Email address is up on the page. If we can be a resource to you, please do not hesitate to reach out to us. And then I did also want to thank Takeda and Sanofi, who are our webinar series sponsors, for their support in helping to make this possible. So thank you all for joining us. Any last words, Patrick or Debbie, that you want to share?
I'll say what I just said in the chat, which is thank you to you and the HCC for being so on this. Just as a patient and community member, it's really encouraging, and it doesn't come without a lot of work on your part and your team's part, and prioritization on your part. So thank you for prioritizing this and being so thoughtful in what you presented today. It's really important, so thank you.
Thank you both. All right, well, thank you all for joining us, and we hope to see you at our webinar next month.